Hi, Assalamualaikum. My name is Nisa. So now I will start with introduction. The skull is the body's more complex bony structure, and it is the bony framework of the head, which contains 22 bones, not counting the bones of the middle ears, and rests on the superior end of the vertebral column. The bones of the skull are grouped into two categories, which are the cranial bones and the facial bones. The cranial bones or cranium enclose and protect the brain and provide attachment site for some head and neck muscle, while for facial bones form the framework of the face, form cavities for the sense organs such as sight, taste, and smell, provide opening for the passage of air and food, hold the teeth, and anchor the muscle of the face. Next, we move on to the anatomical skull. The 8 large bones of the cranium are the preparietal and temporal bones. And for the arm pair is frontal, occipital, sphenoid, and ethmoid bones. Together, these bones form the brain's protective shell. Because its superior aspect is curved, the cranium is self-bracing. This allows the bones to be thin and like an eggshell. The cranium is remarkably strong for its weight. I will describe a little bit about the cranial bones. So the first one is the parietal bones. The two parietal bones form the greater portion of the side and roof of the cranial cavity. The side at which the parietal bones articulate or form a joint with other cranial bones are the four largest sutures, which are the coronal suture, squamous suture, sagittal suture, and lambdoid suture. Next is temporal bone. The pay-temporal bones form the inferior lateral aspect of the cranium and part of the cranial floor. Then, frontal bone. The frontal bone form the forehead, which is the anterior part of the cranium, the roof of the orbit or eye socket, and most of the anterior part of the cranial floor. Soon after birth, the left and right side of the frontal bone are united by the metonymic suture, which usually disappear between the age of 6 and 8. For occipital bones, the occipital bones or back of the head makes the posterior part and most of the base of the cranium. It articulates with the parietal bones at the occipitomastoid suture. For sphenoid, the sphenoid lies at the middle part of the base of the skull. This bone is called the keystone of the cranial floor because it articulates with all the other cranial bones, holding them together. The sphenoid joins anteriorly with the frontal and ethmoid bones, laterally with the temporal bones, and posteriorly with occipital bone. The sphenoid lies posterior and slightly superior to the nasal cavity and forms part of the floor, side walls, and rear wall of the orbit. Lastly is the ethmoid bone. The ethmoid bone is a delicate bone located in the anterior part of the cranial floor, medial to the orbits. It is anterior to the sphenoid and posterior to the nasal bone. The ethmoid bones form part of the anterior portion of the cranial floor, the medial wall of the orbits, the superior portion of the nasal septum, a partition that divides the nasal cavity into the right and left side, and most of the superior side wall of the nasal cavity. The ethmoid bone is a major superior supporting structure of the nasal cavity and forms an extensive surface area in the nasal cavity. Next topic is biomechanical of the skull. The head attached to the top of the vertebral column is balanced, moved, and rotated by the neck muscle. When this muscle aches unilaterally, the head rotates. When they contract bilaterally, the head flex or extend. The first major muscle that laterally flexes and rotates the head is sternocleidomastoid. The skeletal attachment of the sternocleidomastoid are attached at the mastoid process and lateral half of the superior knuckle line and also at the manubrium of the sternum, medial 1/3 of the clavicle. Next is trapezium. The skeletal attachment of the trapezium are attached to the external occipital protuberance, middle one-third of the superior nuchal line, nuchal ligament, and the spinous process of vertebrae, which is C7 to T12. Besides, it is also located at the acromion and spine of the scapula, lateral one-third of the clavicle. Other physiology of muscle contraction for the skull are splenius capitis. Splenius capitis are attached at the inferior half of knuckle ligament, spinous process of vertebrae of C7 to T6. Besides, it also attached to the mastoid process and occipital bones just below the superior knuckle line of cervical vertebrae of C1 to C2 or C3. Lastly is semispinalis capitis. The skeletal attachment of semispinalis capitis are at the articular process of vertebrae C4 to C7, transverse process of T1 to T6, and also the occipital bone between knuckle lines, spinal process of vertebrae of C2 to C5.
Assalamualaikum and a very good day. My name is Sarah Ashkin binti Azmi. So, from the previous slide, we all know skull bones consist of the attachment of the cranial bones, temporal bone, and also the facial bones. But do you know how it attach to each other? As for this part of the presentation, I will explain about the suture. So, what is suture? The fibrous joints that attach to the skull's bones are known as the sutures of the skull, or cranial sutures. The addition of the bones and the development and closure of the cranial fontanelles are marked by these seemingly intricate thin lines. Collagen makes up the bulk of dense fibrous tissue that joins the sutures. These joints have no hollow and are permanent and immovable. The synostosis is another name for them. The sutures in the fetal skull are wide and permit some mobility during birth, but as the child grows older, they tighten and become fixed. The main sutures for skulls include coronal, sagittal, lambdoid, and squamous. The frontal bone and the parietal bone are divided by the coronal suture. The coronal suture is named because it lies in the coronal plane. The brecma is formed by the convergence of the coronal and sagittal sutures. The two parietals are joined by the sagittal suture, and it is named because it lies in the sagittal plane. The temporal bone and parietal bone are joined by the squamous suture. The boundaries between the parietal and the occipital bones are indicated by the lambdoid suture. A lambda is formed when the sagittal and lambdoid sutures converge. Here is the list of another sutures that includes in the attachment of the skull. At the superior view, we have brecma. At the lateral view, there are sphinofrontal suture, sphenoparietal suture, occipitomastoid suture process of the temporal bone, and temporozygomatic suture. At the inferior view, there are median palatine suture, transverse palatine suture, petrooccipital suture, spheno-occipital suture, petrosquamous suture, and petrotympanic suture. Next, at the posterior view, we have lambda. Lastly, for the anterior view, the sutures includes our frontonasal suture, frontozygomatic suture, zygomatic comaxillary suture, intermaxillary suture, and metopic suture.
Next, we move on to the how the skull are well suited to perform the function that they do. The anatomical structure of the skull is well suited to perform its function of protecting the brain and other vital organs for the severe reason. First, the skull is composed of the several bones that articulate with each other at joint called suture. This suture provides stability and strength to the skull while allowing some movement between the bones. Second, The bones of the skull are relatively thick and strong, which help to absorb and distribute force that are applied to it. Third, the skull is designed to be relatively rigid, which help to protect the brain and other soft tissue within the skull from injury. Finally, the skull is shaped in a way that helps to protect the brain and other vital organs from impact and injury. So overall, the anatomical structure of the skull is well designed to perform its function of protecting the brain and other vital organs effectively.
So this is the drawing of anterior view of the skull that I have drawn using an iPad. So this is the frontal bone. This is the frontal bone of the skull because it's located at the front. And here is the supraciliary arch, and here is the orbital notch or supraorbital foramen. Here it consists of zygomatic process of frontal bone. Okay, moving on here. Here is the glabella, and the inferior from glabella is nasal. Okay, and it consists of a nasal bone. These two sides we call it as piriform aperture, and towards the inferior part we call it towards the piriform aperture is inferior nasal concave, and at the midline of the nasal bone it consists of nasal crest, and below the nasal crest is the anterior nasal spine. Okay. So this whole body is what we call a body of maxilla, and this whole body we call it as body of mandible. For the part of body of maxilla, it consists of two infraorbital foramen, and for towards the mandible body part, it consists of two mental foramen. Besides, in the maxilla body, it consists of alveolar process, but in the mandible body, it consists of alveolar part of mandible. Okay. Alright, so here is the ramus of mandible, and here is the angle of mandible, and towards the body of mandible, it consists of mental protuberance and also mental tubercle. And it also consists of this oblique line of mandible. Okay. Moving on, this is the lateral view of the skull. So we will start with the coronal suture. The coronal suture will connect the frontal bone with the parietal bone. And here is lambdoid suture. Lambdoid suture will connect the parietal bone with the occipital bone. And here is the squamous suture, which connect the parietal bone and temporal bone. Okay. So here is the body of mandible, and it consists of mental foramen and also the alveolar part of mandible. Over here is the maxilla part, and up here is the zygomatic bone, which is the cheekbone, and it consists of zygomaticofacial foramen. Towards the eye, it consists of lacriminal bone, and this is the nasal bone. Besides the temporal bone, it consists of greater wing of sphenoid bone, and here is the patron. Okay. Right. So here is the coronoid process of mandible. and here is the zygomatic process of temporal bone. Over here is the condylar process of mandible, and here is the ramus of mandible. Here is the tympanic part, and here is the mystoid process, and here is the mystoid process of temporal bone.
In this video, I will be explaining about the physiology of muscle contraction for the skull, which is head. Generally, the head is attached to the top of the vertebral column, is balanced, moved and rotated by the neck muscles. When these muscles act unilaterally, the head rotates. When they contract bilaterally, the head will flexes or extend. The first major muscles that laterally flexes and rotate the head is sternocleidomastoid. Its action in bilateral contraction of sternocleidomastoid muscle is to draw the head straight, forward and down. For example, when we are eating or reading. In unilateral contraction, it tilts head slightly upward and toward the opposite side, as in looking over one's contralateral shoulder. It also acts as an accessory muscle of inspiration. Next is trapezius. As we can see on this video, it consists of left and right trapezius. In bilateral contractions up by extending the neck, as in looking up or laterally flexes the neck. For the ipsilateral, side acts as the flexion of the neck. Other functions include side bending and turning the head, elevating and depressing the shoulders, and internally rotating the arm. Other physiology of muscle contraction for the skull or head are splenius capitis. One of the actions of splenius capitis are extension and lateral flexion of the neck and spine, or to be specifically are ipsilateral rotations of the head, such as turning the head toward the side of the body that contains the muscles performing the action. Other actions are spinalis capitis worked with other spinalis and greater erector spinae muscles to produce cervical extension, as well as lateral flexion and rotation of the spine and head. Lastly is semispinalis capitis. When semispinalis capitis acting bilaterally, it causes the extension of head and neck, and when acting unilaterally, it causes the rotation of head and neck to opposite side. Besides, it functions during bilateral contraction. This muscle is considered as a prime mover for dynamically maintaining the cervical lordosis. It is also considered as one of the main factors in maintaining the balance of the head and the neck.
Next, for the last part of this presentation, I will show the sketch radiograph of the basic projection of the skull, which is the PA 0 degrees skull and lateral projection of the skull. As we can see, in the sketch, there are the sagittal suture, coronal suture, parietal bones, lateral cranial cortex, crista galli, dorsum cellae, ethmoid sinus, mastoid, air cells, inferior nasal concave, supraorbital brim, nasal septum, and the oblique line of mandible. As for the lateral radiograph, the structures that can be seen according to clockwise rotation are the vertex, coronal suture, frontal bone, orbital plate, frontal sinus, cribriform plate, ethmoid, air cells, sella turcica, sphenosinus, maxillary sinus, thyroid process, mandibular rami, mandible, external ascitic meatus, mastoid region, occipital bone, mastoid, air cells, dorsum cellae, lambdoid suture, and parietal bones. In conclusion, the skull serves a variety of purposes, including protecting and providing the brain shape. Additionally, the formation, connection, mobility, and usage of the skull by individuals in daily life can all be learned. Therefore, as humans, we must be appreciative of the favor that God showers upon us and take care of it.